Hello, I'm Norbert Gleicher, MD. I'm the Medical Director and Chief Scientist here at the Center for Human Reproduction with my colleague, Dr. David Barad, who heads up our clinical IVF program and our research program. And so we thought we'd talk a little bit about the angst that so many couples experience who enter the journey through an infertility treatment process. And the numbers of people who need that is quickly growing because infertility is aging in the sense that couples are delaying, or single women are delaying childbearing, and obviously as a woman gets older, especially a woman gets older, achieving pregnancy is getting more and more difficult. And the stresses involved, time, finances, succeeding, not succeeding, are just overwhelming at times. And one just has to read the comments on the internet to know how stressed out some of these patients can become.
You know, couples, we all begin our lives worried about pregnancy. We're dating, we don't want to have an accidental pregnancy, you're taking birth control, you're planning your life so you don't get pregnant, and then you get to some point where you want to be pregnant, and you presume that it's a natural thing, it should happen like waking and sleeping and walking and eating and using the bathroom. It should just happen because it's a natural process. And when it doesn't, you feel like you've been...
Yeah, you feel disappointed,
you
feel devalued
cheated.
In a way.
Yeah, like there's something wrong with you.
Yeah, exactly.
And then you add to that the cost of going through fertility, the medications that you take, which move your hormones around. We all know hormones affect the way we feel. I mean, just as an example, many people get what they call premenstrual syndrome, sort of feel differently in the second half of the month than the first. But the levels of hormones that you get when you're going through an IVF cycle or any kind of ovulation induction are 10 to 20 times higher than you would experience in a normal cycle. So I always counsel my patients when they're going through, listen, when you're going through this cycle, you may be walking down the street, you'll see a puppy and you'll start crying, or you see a baby and you'll start crying. You just feel your emotions so much greater, and add to that the cost and the anxiety of spending all this time and money and not knowing it's going to work.
And then having the 2 weeks of waiting for the next pregnancy test. Am I going to get my period, or am I not going to get my period?
On top of being uncomfortable, and your backside hurts because of injections, and your tummy hurts because your ovaries are big, it's trouble. And then the poor husbands who love their wives, but they can't take the bullet because the wives are carrying all the weight, and you know, it's a lot of anxiety. And really the best way to deal with it is to talk about it to each other, talk about it to others who are dealing with it. Luckily we have forums where people get together now, things like through Resolve or through other online...
just chat rooms. There are chat rooms addressing various issues in fertility. We strongly encourage our patients to participate in them because they get a lot of interesting information. There's sometimes also some not so correct information out there, but in general, those chat rooms are very helpful and give patients information that they otherwise wouldn't have.
Well, it's good to know that you're not alone, that you're not crazy experiencing or feeling this, because everybody who goes through this gets this level of anxiety and these feelings about themselves.
Especially if you don't succeed in the first cycle or even the second cycle.
Also, we have many colleagues in the mental health field who've now specialized in caring for people with fertility problems, and we greatly encourage you to seek.
It has become a specialty.
Yeah.
It clearly has become a specialty. And it is also important to mention here once again age, because it obviously makes a big difference whether you're 25 and having a hard time getting pregnant, or whether you're 45. And the issue is not only getting pregnant, but also the fear of going into menopause already. So the stresses can be really extraordinary, and for obvious reason much more so on the female than on the male side. But I'm always surprised by how much the husbands are affected, and sometimes they need more help than their wives in calming them down. So I think what we basically want to say to everybody out there is that here at the CHR we understand these stresses, and we are doing our utmost to minimize them. We have a system of being available 24 hours, 7 days a week, and we are here to help, not only at the Center for Human Reproduction with our staff availability, but also, if needed, with referrals to, as you said, psychologists, psychiatrists, mental health providers, groups that are addressing those issues, etc. And with this month now once again upon us, it's a good time to remind everybody out there, as you said, that they're not alone. Thank you very much.
Thank you.